It's an exciting time because we have several antibodies being tested in multiple myeloma, and actually 2 antibodies are now on the market in the US, and we're expecting also the licensing for Europe this year. So 2 antibodies ready to go into clinic, and this is Elotuzumab and Daratumumab, so quite active antibodies which will certainly add to make myeloma therapy more active. Obviously, these antibodies work very well in conjunction with drugs such as lenalidomide or dexamethasone. And for instance, Elotuzumab is not active as a single agent, but quite active in combination. And it was licensed in this combination with Len-Dex because it then prolongs progression-free survival. And it was very interesting to see that especially those patients with a good response to the initial therapy have the longest benefit in terms of progression-free survival. So there seems to be a kind of immune mechanism being active which maintains remission. For Daratumumab is another story. It has quite a potent single-agent activity, about 30% response rate in heavily pretreated patients. And thus it's licensed in the US for these patients after multiple relapses, being double refractory. And we expect the license in Europe also in this setting as a single agent, kind of last line therapy. But it's going to be very interesting to see how the studies which are underway now for combination trials will perform, and whether we will also use this antibody in an earlier setting, in early relapse, or even in first-line therapy. So both antibodies have a very high potential to enhance our capacities to retreat patient as salvage treatment, but they all are being tested in first-line therapy as well.